Welcome back to the Healing Wellness Show. I'm Dr. Karim, and in today's episode, we're talking about knee pain, something that affects millions of Americans every day and can make walking, standing, climbing stairs, or even sleeping feel like a chore. Whether your knee pain is from arthritis, injury, wear and tear, or something more mysterious, today we're going to break down the causes, treatments, and most importantly, solutions. So let's jump in. So I've got with me here today is Mark. Mark will be asking me questions as they come along here from our viewers. Mark, why don't you go ahead and introduce yourself here real quick?
Yes, my name is Mark Anthony here. We're going to be speaking of understanding knee pain. As you know, this is something very vital where many are dealing with knee pain and they're feeling stuck. They feel helpless. And so, one of the big questions we have today is what are the most common causes of knee pain, Dr. Mo?
There's lots. I mean, it could be injury, fall. Knee pain can also come from osteoarthritis, meniscus damage, ligament strains, tendinitis, inflammation, biomechanics, lots of different things. So, and it could be a referral, like a referral pain from back or hip. So often it's not just one issue, it's a combination.
Awesome. The next question that we have right now up in Dallas, Texas, Joe is asking, what does early knee pain feel like?
It feels stiffness, could be like dull aches, swelling, and it could be swelling after activity or just swelling, just sitting there. Could be pain going up and down the stairs, but really ignoring these signs often lead to chronic degeneration.
Awesome. The next question we have is, what are red red flag signs that require attention?
It's usually sharp pain, I would say, is number one. Swelling for sure. Some people will describe it as like clicking or grinding, instability where it feels like your knee is going to give out. Uh, um, or I would say like if inability to fully bend or straighten your knee. All those should really get evaluated right away.
Awesome. Let's talk a little bit about the patient experience. One of the questions is, how does knee pain affect daily life?
I mean, if you have knee pain, you're experiencing it. It could, slow you down at work. It could stop you from walking as much. So you're taking more breaks, avoiding stairs because it really hurts whether going up or down or both. Missing out on family activities is the big one that I always hear because they're not able to walk or sit with them or play with the kids. But your body compensates, so creating pain elsewhere. So a lot of times we'll have someone say, hey, my right knee hurts, and if we didn't evaluate the other knee because they didn't want us to, well, guess what, it might start, the one they came in for starts to get better, but then what happens is it really originated in another one, and the other one starts to hurt because they were compensating. So creating pain somewhere else, and that could be in the hips or back or ankles. So it could really lower your quality of life.
Wow. So, why do so many people delay treatment? Is the next question.
I think the biggest one that we get is fear of surgery. A lot of people nowadays are not wanting the surgery. So thinking pain is just a part of aging is another one, but it's not. It shouldn't be. Okay. Or being told they're bone on bone, but really they're not bone on bone. And a lot of times they're told they're bone on bone. It's because that doctor isn't able to help them anymore. So they're like, it's bone on bone, let's do the surgery. But a lot of times when someone isn't truly wanting surgery and they come in, they get evaluated with us, we will tell you if it's bone on bone. And I had one that was really gnarly. It was truly bone on bone. It was like really dug in and it caused a lot of damage. And I told him, we can't do any, that is true bone and bone, that truly needs surgery. If someone tells you it's bone and bone and there is still some spacing, and no, we can do things with that. And we've helped a lot of people do things with their knee and avoid surgery. So that's it, yeah.
Okay, the next question that we have here is, what do you say to someone who's tried everything and nothing seems to work.
There's always another option. I would say if you've tried everything, once you come in and see if you've tried the relief knee protocol. Our clinic specializes in regenerative non-surgical knee pain, and that's where I developed the relief knee protocol, where we get down to the root cause, not just the symptom. A lot of times when people say, hey, I've tried everything, I will start asking them questions. They'll be like, no, haven't tried that. No, haven't tried that. No, haven't tried that, with a lot of stuff that we do. And I go, well, you haven't tried everything. Because a lot of times when they go somewhere, they're trying to manage the symptom and not really the root cause.
Awesome. We have another question here, which it seems like people want to know more about your knee treatment approach. What services do you offer for knee pain? How does that look like?
Again, that depends on the patient, the severity, what we find from the X-rays and the console. But we have lots of things that we offer. Big ones would be like knee decompression, which is traction of the knee, because a lot of times, just looking up here, these are your two leg bones. A lot of times there's a rotation that we see, and that's why we see that the kneecap looks like it's not in place. So we need to do knee traction, get it kind of pulled and pulled back in place. That takes time because you've got the ligaments, the muscles that kind of hold and gunk the joint. Laser, cold laser, and that's to reduce inflammation, pain, gets the cells excited again to start healing. Again, talking back about mitochondria, getting that started. Shockwave or sound wave therapy, that breaks down scar tissue, stimulates the healing, activates your own body stem cells to go in that area and start to heal that area. PEMF therapy, which is pulse electromagnetic field chair. Again, that helps to restore the cell balance. So it's the voltage in the cells that can decrease. So we're increasing that. So again, it starts back in biology class. If anyone remembers, it's the Krebs cycle. It really jump starts that again. It could be in the medical side. We could do some PRP injections, platelet-rich plasma injections, or stem cells. Could be ozone injections. So again, putting high-dose oxygen in the joint. Could be as simple as just chiropractic care to align simple misalignment. Or it could be nutritional support, reduce joint inflammation. So there's lots of different things out there.
So let's go a little bit deeper. What is the relief knee protocol? What does it stand for?
Yeah, so the relief knee protocol is something that I've created in my clinic. So we'll go through it. So the R in the relief, that's really rehydrate the joint, and that could be with laser or like the decompression therapy, the knee traction. So we're just trying to get more hydration in that disc. The E in the relief protocol is eliminate inflammation. Again, we need to get rid of inflammation. And that could be with whether doing a gut health program to decrease inflammation in the body. It could be with PEMF, the pulse electromagnetic field chair, shockwave therapy, lots of different things. The L in the relief protocol, that's to lubricate the cartilage and support the synovial fluid production in that joint. The I in the relief protocol is to improve joint alignment and the mobility. And that could be with the rehab. We have lots of different equipment that we use. Could be just chiropractic care. So lots of different things. And then the E in the relief protocol, that's to enhance regeneration. And that could be using the PRP or stem cells in our medical side. And then finally, the F in the relief protocol, that's functional rehab or strengthening and stabilizing the joint for long-term results.
Sounds awesome, Dr. Mo. Love what you're doing. We'd like to go a little bit deeper. Another question we have is, how long does it take to see results with your knee protocol? We know that everybody is different, but what is the average?
Yeah, so again, like I always say, we whatever we do for the body. The body is the one that heals itself. Some people, it could be a few weeks, some people, it could be a few months, but many patients really report reducing pain and swelling within 3 to 4 weeks. The full program usually runs about 3 to 5 months, and that's really depending on the severity.
And also another question we have is this right for everyone that's struggling with knee pain?
Like I said, we perform a full evaluation first, and this isn't for people that are looking for a quick fix. It's for those really that want to commit to a long-term healing without surgery. And then, like I said earlier, if you are a candidate, we'll let you know. If you are not, we will also let you know. And if you're not, then we will refer you to one of our providers that are in our network, in our community.
So, with this next thought, we'd love to hear some more patient success and final insights on that example. Can you share a success story that you've seen in your clinic currently?
Yeah, I think it was about a 55-year-old, 58-year-old teacher that came in, barely was able to go up and down stairs anymore. Tried injections, corticosteroid injections, braces, and, had no long-term success, with the injections. She told me she kept going in every 3 to 4 months. And yeah, it felt good for a few weeks, but then it would come back again. But really, after starting the relief knee protocol, I would say after about 8 to 10 sessions, she was able to start walking again. Her 2 miles a day that she used to do, she was able to get back to gardening, and she was able to go up and down the stairs with minimum pain.
The next question we have is, what's the biggest myth about knee pain that you're seeing in your clinic or that you're hearing on the internet?
That you're doomed if you have bone on bone. That's the biggest one. Is a lot of times they'll come and say, "Oh, my doctor said it's bone on bone and I have to get surgery." And that's not really true as long as we do the evaluation. Again, if you are, we will let you know and say, "Yes, go get that." But if you're not and we can do something, we'll let you know. But we've seen tremendous improvement in patients who were told surgery was their only option.
Awesome. So, what would you say right now as I would say more of a final encouragement to people?
That you don't have to live in pain. Movement is life, and we're here to help. And we're here to help you move better, feel better, and live better. It's one step at a time. Thank you for tuning in to the Healing Wellness Show. If this episode helped you better understand your knee pain or gave you hope or hope for a loved one, well, go ahead and share it with someone that you care about. Go ahead and visit the website or give us a call that's on the screen to schedule your knee evaluation today. I'm Dr. Karim, and I'll see you next time.